Well, probably the most mature use of artificial intelligence applied to clinical medicine is in the field of imaging. I'm a cardiologist, so particularly cardiac imaging, and that would include echocardiography and cardiac MRI. And the intention here is to use artificial intelligence to assess cardiac volumes, cardiac function, and ultimately act as a diagnostic aid for the clinician. Ultimately, the clinician takes the responsibility for making the diagnosis, but in terms of accurate measurement of cardiac volumes, of the velocity signals, etc., from echocardiograms and cardiac MRI, it may be that artificial intelligence is able to do this much faster, much more reproducibly, and possibly more accurately than a human looking at the images. So I see it as a diagnostic assistant. Soon, I think that we'll see artificial intelligence applied to the ECG. I think it's a little bit more difficult there because ECG is a much more mature technology. It's 100 years old or more, and there's a huge amount of human intelligence in the ECG. But going back to the digital ECG, it's possible that we're going to see new applications where, rather than the ECG being used for diagnosis, it's used to predict what will happen in the future, which is not what we do with an ECG today. So you can see there's a change in use of the ECG. Well, I think I've summarized it above. I think that it is mainly in the cardiac imaging and in the near future, the ECG. I think when it comes to identifying treatment patterns and diagnosis, clinical diagnosis, I think we're a long way before we'll find a good use of artificial intelligence. Because ultimately, you've got to have the courage to not treat a patient on the basis of the information supplied by the artificial intelligence. So, I guess to give an example, I have a patient with a high cholesterol who the guidelines say should have a statin. But the artificial intelligence says that the patient is at very low risk of events, not by conventional risk factors, but by the artificial intelligence program. Am I really not going to treat that patient with a statin because the artificial intelligence has told me not to? And I think that we're decades, maybe more than decades away from being able to use artificial intelligence in that way. So I think ultimately artificial intelligence can be used to help doctors make decisions, but in terms of treatment, but it doesn't make decisions for them. Well, I thought it was a very intelligent study. I think that Professor Gao had thought very carefully about how the information from the smartwatch could be developed. Importantly, as I was saying above, with ECG, the most important use of artificial intelligence may not be in diagnosis, but in predicting future events. And in this case, Professor Gao was trying to predict the probability of developing atrial fibrillation, and then to advise a change either in lifestyle. So it might be, taking more exercise, losing weight, altering diet, or potentially taking medication prophylactically to prevent the possibility of atrial fibrillation. The smartwatch could also detect the onset of atrial fibrillation using a technique called PPG. So this was a way the smartwatch can continuously monitor the patient for atrial fibrillation. But finally, and very interestingly, we know that PPG may have some inaccuracies. And so the ability to also do a confirmatory single lead ECG, which would be the trigger to treatment, was very important. So I think that the fact that the watch wasn't trying to do one thing, it was actually doing three quite separate tasks, I think makes it a very interesting intervention. Well, I think almost certainly it's going to be an auxiliary tool for quite some time. I think that we should think about man and machine working together. So the human intelligence and the artificial intelligence being complementary. I think that the relationship will start out with the human being 90% and the artificial intelligence being 10%. But over time, probably decades, that relationship will change and a new balance will be found. And maybe in 100 years' time, it will be 10% human and 90% artificial intelligence. Maybe, there's just that possibility that the artificial intelligence will take over completely, but I think it will be a long time.